Welcome all of you my YouTube channel. This video I am going to talking about condom. First of all, if you are not yet subscribed my channel, please subscribe it. If you have any questions, please leave a comment. A condom is a barrier method of contraception that is used to prevent pregnancy and protect against sexually transmitted infections (STIs). Condoms are one of the most widely used and accessible forms of birth control due to their effectiveness, affordability, and dual protective function. They are available for both men and women, though male condoms are far more commonly used. Types of condoms. Male condoms. Material. Male condoms are typically made from latex, but there are also non-latex options made from materials such as polyurethane, polysoprene, and lambskin. Latex condoms are the most common and effective against both pregnancy and STIs. Non-latex condoms are used by individuals who are allergic to latex. Design. A male condom is a thin, flexible tube that is closed at one end and typically has a small reservoir tip at the closed end to collect semen. It is worn over the erect penis during sexual intercourse to prevent semen from entering the vagina, anus, or mouth. Lubrication. Many condoms come pre-lubricated to reduce friction during intercourse, enhancing comfort and reducing the risk of the condom tearing. Some condoms are also available with added spermicide for additional pregnancy prevention, although spermicidal condoms are less common due to concerns about irritation and increased risk of infection with repeated use. Female condoms. Material. Female condoms are typically made from polyurethane or nitrile, making them a good alternative for those with latex allergies. Design. The female condom is a loose-fitting pouch with a closed end that is inserted into the vagina. It has a flexible ring at each end. One ring is placed inside the vagina to hold the condom in place, and the other ring remains outside the vagina, covering the external genitalia. Usage. Like male condoms, female condoms provide a barrier to prevent sperm from entering the vagina and offer protection against STIs. They are less commonly used, but offer the advantage of being controlled by the female partner and can be inserted up to 8 hours before intercourse. Effectiveness. Pregnancy prevention. When used correctly and consistently, male condoms have a typical use effectiveness rate of about 85, meaning that 15 out of 100 women will become pregnant within a year of using condoms as their primary method of contraception. With perfect use, the effectiveness rate rises to about 98%. Female condoms have a typical use effectiveness rate of around 79%. Protection against STIs. Condoms are the only form of contraception that provides significant protection against sexually transmitted infections, including HIV, gonorrhea, chlamydia, and syphilis. Both male and female condoms are effective at reducing the transmission of STIs when used properly. Advantages of condoms. Accessibility. Condoms are widely available over the counter at pharmacies, grocery stores, and online without a prescription. Affordability. They are relatively inexpensive and often available for free at clinics and public health organizations. Non-hormonal. Unlike other forms of birth control, condoms do not contain hormones, making them suitable for people who prefer or need to avoid hormonal contraception. Dual protection. Condoms offer dual protection by preventing both pregnancy and the transmission of STIs, making them a valuable option for sexually active individuals and couples. Ease of use. Condoms are easy to use and do not require advanced planning beyond having them on hand before intercourse. Minimal side effects. Most people can use condoms without experiencing side effects, although some individuals may have allergies to latex or sensitivities to lubricants or spermicides. Disadvantages of condoms. Interruption of spontaneity. Some people find that stopping to put on a condom can interrupt the flow of sexual activity. Risk of breakage or slippage. Condoms can occasionally break or slip off during intercourse, reducing their effectiveness. This risk can be minimized by using the correct size and following instructions carefully. Reduced sensation. Some individuals may feel that condoms reduce sensation during sex, which can affect sexual pleasure. There are, however, ultra-thin or sensation-enhancing condoms designed to address this issue. Allergies. Some individuals are allergic to latex, which can cause irritation or discomfort. Non-latex options are available for those with allergies. Usage and best practices. Correct application. For male condoms, the condom should be rolled onto the erect penis before any genital contact occurs. It should be unrolled all the way to the base of the penis, leaving space at the tip to collect semen. After ejaculation, the condom should be held at the base while withdrawing to prevent it from slipping off. Single use. Condoms are intended for single use only and should be discarded after each act of intercourse. Storage. Condoms should be stored in a cool, dry place and kept away from direct sunlight and sharp objects. Condoms that are expired, brittle, or sticky should not be used. Lubrication. Water-based or silicone-based lubricants should be used with latex condoms to reduce friction and the risk of breakage. Oil-based lubricants should be avoided with latex condoms as they can weaken the material. Cultural and social considerations. Perceptions and misconceptions. There are cultural and social perceptions surrounding condom use, including myths about their effectiveness and impact on sexual pleasure. Public health campaigns often work to educate the public on the importance of condom use for sexual health. Negotiation in relationships. The decision to use condoms can sometimes be a point of negotiation in sexual relationships. Effective communication between partners is important to ensure mutual consent and safety. Conclusion. Condoms are an essential tool in sexual health, providing a reliable and accessible method of contraception and protection against sexually transmitted infections. Their effectiveness, combined with ease of use and affordability, makes them one of the most popular and widely recommended forms of birth control. Understanding how to use condoms correctly and addressing any concerns or misconceptions can further enhance their benefits and promote safer sexual practices.